Assalamualaikum and hi everyone. My name is Zulaikha Binti Zamzuri. Today, I would like to present my informative speech entitled Speech Delay in Children. What parents should know. To begin with, imagine a 3-year child who still cannot form simple sentences while other children of the same age are already talking actively. Currently, this situation can be worrying, especially for parents like me. In general, speech and language development is a very important part of a child's yearly growth. Through speech, children learn to express their needs and their emotion. However, some children experience delay in this area, which we call speech delay. Therefore, today my purpose is to inform my audience about speech delay in children. Specifically, what it is, its causes, and how parents can help through yearly intervention. As a parent myself, this topic is very meaningful to me. So now let's move to my first main point, which is what speech delay is and its common sign. Firstly, speech delay happens when a child does not reach the expected speech and language milestone for their age. In other words, the child may speak later than expected, use fewer words, or have difficulty forming sentences. For example, at 1 year old, children can say simple words like mama, papa, or bye. At 2 years old, they can use above 50 words and form 2-word phrase like one meal. And 3 years old, they can speak in simple sentences and be understood by adults. As you can see, this chart shows how speech ability increases with age. If a child is so far behind this pattern, it may be an early sign of speech delay. Besides that, other warning signs include: first, not responding when their name is called, limited eye contact, difficult following simple instruction, using gesture instead of word, very little babbling as a baby. In short, early detection is very important because the earlier the problem is identified, the better chance for improvement. Next, let us look at my second main point, which is the causes of speech delay. There is no single cause of speech delay. Instead, it usually happens due to several contributing factors. Firstly, hearing problem. Children with frequent ear infection or hearing loss may find it difficult to hear words clearly and learn to speak. Secondly, developmental condition, such as autism spectrum disorder or general developmental delay. However, it is important to remember that speech delay does not always mean autism. Thirdly, lack of stimulation. For instance, when children have too much screen time and limited interaction with adults, their speech development may slow down. And finally, bilingual environment. Children who grow up learning 2 languages will take slightly longer to speak, but this is usually temporary. From this pie chart, we can clearly see that speech delay is caused by multiple factors, which hearing loss being the highest contributor. With that understanding, we can now move on to my third main point, which is early intervention and how parents can help. Thirdly, the good news is that speech delay can improve, especially when help is given early. One of the most effective treatment, for example, is speech therapy, where therapy uses fun, play-based activity to improve a child's communication skill. In addition, there are also yearly intervention programs that support children below 6 years old in their language, social, and learning development. At the same time, parents play a very important role at home. Among the way parents can help is talking frequently with their child, reading storybook every day, encouraging imitation of sound and action, reducing screen time, labeling objects like cup, ball, and shoes, responding patiently when the child tries to communicate. As shown in this graph, we can see a clear improvement in the child's speech progress from session 1 to session 8. The number of therapy words increased significantly and the generation word also improved steadily. These clearly show that with consistent speech therapy and yearly intervention, children with speech delay can make real and measurable progress. In conclusion, speech delay is a common issue among young children, and it is nothing for parents to feel ashamed of. What matters most is yearly awareness and yearly action. Okay? To summarize, today we have learned, first, we know what speech delay is and its sign. Second, the possible causes. And the last is how yearly intervention and parental support can help. Ultimately, with proper guidance, patience, and continuous support, children with speech delay can develop strong communication skills for their future. With that, I would like to thank you very much for your attention.